This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, August 26th, and I'm Zach Caruso. Our lead story this week is from JAMA Network Open and is titled Injectable-Only Overlapping Buprenorphine Starting Protocol in a Low Threshold Setting. Injectable-only buprenorphine protocols are an exciting new strategy for buprenorphine initiation, particularly in the fentanyl era. This is a cohort study of 95 patients with moderate to severe opioid use disorder who received care in a low-threshold setting in Seattle. 79% of patients included in the study were experiencing homelessness or living in permanent supportive housing. Patients selected a long-acting injectable or LAI buprenorphine initiation protocol, which included 3 escalating doses of LAI buprenorphine over 3 days, with no sublingual buprenorphine and without cessation of fentanyl/opioid use. 75% of the patients completed the protocol, and 64% received a second monthly dose of LAI buprenorphine. Next is an article in the Journal of the American Academy of Child and Adolescent Psychiatry titled Clinical Practice Guideline, Assessment and Treatment of Adolescents and Young Adults with Substance Use Disorders and Problematic Substance Use, excluding tobacco. This clinical practice guideline highlights 4 empirically supported treatment suggestions for SUD and problematic substance use, or PSU, in youth. Suggested safe and effective short-term treatments for SUD/PSU in adolescents and young adults include brief motivational interviewing for alcohol use, non-brief motivational interviewing, family therapy, or cognitive behavioral therapy for alcohol use or disorder with or without other drug use, motivational interviewing plus cognitive behavioral therapy for illicit drug disorders, behavioral interventions for college students with problematic alcohol use, and longer-term buprenorphine treatment and slower buprenorphine taper for opioid use disorder. The strength of evidence was insufficient to support suggestions or recommendations for the pharmacological or behavioral treatment of any other adolescent SUD/PSU. Despite the magnitude of the problem, there is a paucity of safe and effective treatments for adolescents and young adults with SUD/PSU, suggesting the urgent need for additional research. Next is a study in JAMA Psychiatry titled Cigarette Smoking During Recovery from Substance Use Disorders. This longitudinal survey cohort study of 2,600 participants assessed if changes in cigarette smoking predict SUD recovery over time, accounting for between-person confounders. It found that within-person transitions away from smoking were positively associated with SUD recovery in a nationally representative cohort. Quitting smoking increased the odds of SUD recovery by 30% in fully adjusted models. Findings were robust in sensitivity analyses. These results imply that quitting smoking is linked to better SUD recovery outcomes. Smoking cessation could be a tool for assisting the recovery process among the millions of U.S. adults with a current SUD. Our next article is in the Journal of Public Health and is titled Understanding Barriers and Motivators for Problem Gambling Screening by Professionals in Healthcare and Social Assistance Settings. Researchers conducted a mixed methods approach with survey and interview of professionals who work with clients who may be at risk for gambling harms to assess intention and behavior around talking to clients about gambling. The researchers used the theory of planned behavior as a model for the study and found that perceived opinions of colleagues influenced intentions to discuss gambling, and perceived behavioral control predicted both intentions to and discussing gambling with clients. In addition, researchers identified barriers to discussion, including uncertainty or lack of knowledge about screening techniques and referral pathways. Next is a study in PLUS One titled Perceived Social Support According to the Type and Number of Addictions. This questionnaire-based study sought to identify whether perceived social support, or PSS, varies according to different types of addiction and/or the presence of multiple addictions. 5,600 young men in Switzerland completed a questionnaire that included a scale measuring for PSS, as well as standardized screening tools to identify addictive behaviors and consumption of alcohol, cannabis, and nicotine. In this sample, 24% met screening criteria for one addiction and 9% for 2 or more addictions. Nicotine use disorder was the most prevalent substance use disorder, identified at 16%. Gaming disorder was much more prevalent at 10% compared to gambling disorder at 1%. Results showed that young men with gambling or gaming addiction reported the lowest levels of PSS, and the rates of PSS decreased with multiple addictions in a linear fashion. Next is a study in Frontiers in Bioscience Landmark titled Comparative Analysis of Genetic and Epigenetic Factors in Meth Addiction, a focus on SLC, SLC6A4, and COMT genes. This study reviewed 25 papers investigating the relationship between genetics and meth addiction. The COMT gene codes for an enzyme responsible for the metabolism of catecholamines such as norepinephrine and dopamine. The MET-MET polymorphism of the COMT gene reduces enzyme activity and reduces the risk of meth addiction, while the VAL-VAL polymorphism increases both enzyme activity and risk of meth addiction. The SLC6A4 gene codes for the serotonin transporter, and the presence of the S allele increased the risk of meth addiction and early onset meth use. Epigenetic modifications of these genes also influence addiction pathways. Our next article is in Drug and Alcohol Dependence and is titled Amputation Trends Among People Who Use Drugs in the Context of Philadelphia's Increasingly Xylazine Adulterated Drug Supply. In Philadelphia, the presence of xylazine in the opioid supply has been increasing from 2017 to 2023, when 99% of opioids contain xylazine. In 2017, 7% of overdose deaths in Philadelphia involved xylazine, increasing to 34% in 2021. This study included inpatient visits with a diagnosis of opioid-related disorder at 4 Philadelphia hospitals between 2018 and 2023. During this period, the rate of amputations in patients with opioid-related disorder increased from 0.8% in 2018 to 1% in 2023. Higher rates of amputation were seen in males and patients with diabetes. The increasing presence of xylazine in the opioid supply was associated with a doubling of the rate of amputations. Our final article is in BMJ and is titled Alcohol Screening and Brief Intervention in Clinical Practice. The authors of this editorial review some of the literature on alcohol screening and brief intervention, or ASBI, and suggest the real-world effectiveness initially indicated in early studies has not come to fruition. The authors suggest that ASBI mostly targets risky drinkers who have low morbidity and whose behavior often regresses to the mean, and ASBI adds limited effect in this natural remission. The authors suggest more benefit in screening for and early detection of higher-risk patients with alcohol use disorder, with the goal of earlier linkage to alcohol treatment specialists. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.